Missing school, stay-at-home orders, disrupted routines. It's hard enough for children and families, but especially hard for children with autism right now. And we're joined via Skype today by Dr. Shafali Jeste with the UCLA Center for Autism Research and Treatment. Dr. Jeste, how should you talk to your child with autism about COVID-19?
Hi there. Yeah, thanks for having me. It's a great question. I think that the key is to keep it simple and to explain to your child that the schedule is going to be a little different now, and that for a variety of reasons, school is happening at home, and that this is a fun opportunity to get to learn at home. I think really what's key is to try to stick to some sort of schedule at home. It's tough. We're all struggling with this, right? We're trying to balance work and home and all sorts of things, in this new environment. And to try to stick to some schedule so your child has a sense of structure is really, really important.
Would you say that's the biggest challenge, or what would you say is the biggest challenge of this pandemic for families with children with autism?
Yeah, no, and I always say that I think one of the sort of unintended victims of this physical distancing, social isolation are families of kids with developmental disabilities, because what we might not realize is that children with disabilities receive all of their services and supports through the school system. So when they're now at home, they're often unable to receive those supports and services in the same way. And that's a big challenge. So that includes not just educational supports, but also things like speech therapy, occupational therapy, physical therapy. Those interventions are not available in the way that they were when they were at school.
So what would you say, maybe suggest some tips for dealing with the challenging behaviors that can be caused by all of the stress and anxiety?
Right. So I think the main thing I always tell my parents and my patients, because I'm doing a lot of telehealth right now with my patients, is, don't expect too much. You're not going to be able to recreate school at home. Having said that, I think some simple tips can be helpful. Number one is, as I said, stick to a schedule, particularly the first 2 hours of the morning and the last 2 hours of the day. So try to get your kiddos up, at the time they would be getting up for school, and have some routine for the first 1 to 2 hours. It could be physical exercise, it could be some school-based programs, something to get them up and into their routine. And then the same thing at the end of the day, because you want to make sure that your child is going to bed at a regular hour so that they're getting a good night's sleep. So try to stick to a schedule. And then the second is, I would say, try to also make sure that, physical isolation is not the same as social isolation. So stay connected with your, friends and your colleagues and other parents, and stay connected with your healthcare providers. We are all able to provide telehealth. UCLA has done a great job of opening up telehealth slots for patients. And talk to your providers and make sure that they know that you need help if you do.
Some very good information that you shared with us today. We want to thank you, Dr. Jeste, with UCLA, for being with us today.
Thanks so much for having me, and take care, everyone. Stay well.
Now, for more information and resources about autism and COVID-19, visit the UCLA website. We have a link under news links at actionnewsnow.com.